Recently, we heard incredibly positive news from Pfizer and Moderna regarding their coronavirus vaccines. Pfizer with a 90% efficacy rate for the coronavirus vaccine, and Moderna with a 94.5% efficacy rate for a coronavirus vaccine. Those numbers sound high to you. They are, because the average flu vaccine, for example, on any given year is anywhere from 40 to 60% effective. The polio or measles vaccines are in the close to 90 to 100% effectiveness range, but it is unheard of to see a viral vaccine that is this high in its efficacy. And what that tells us is that we should probably expect those numbers to decrease a little bit as it gets rolled out in many populations, but it won't decrease in half. So how will you know which vaccine to choose if you're offered a choice? Well, it's highly unlikely that you'll have the luxury of making choices, because you can imagine that if there is a vaccine with this high of a rate of promise, everybody is going to want one, which could unintentionally take away vaccines from people who really need it. So the earliest doses will be prioritized for special populations, highly likely to be limited to frontline healthcare workers, as well as potentially vulnerable elderly in institutional settings like nursing homes. And every month or so, there will be an amendment filed to the FDA emergency authorization for a certain population. For example, people over the age of 50 with certain chronic conditions. But one thing it's safe to say is that young, healthy adults might be the last people to receive this vaccine, which is why we probably won't see most Americans getting this until late summer to fall of 2021. But then what happens after that really depends on the data. Unfortunately, we don't know what happens to coronavirus vaccines after 2021. It's possible you only need 2 shots and then you're done. It's possible that we might need more than one vaccination series like we have with the flu every year. And in that case, I fully expect there to be more choices available to Americans. But at least in the beginning, I would say that it's unlikely you'll be able to choose between manufacturers, which brings us to where we are today. It is possible that after Thanksgiving, because of travel and exposures, that we could be looking at 200 to 250,000 cases a day. That means millions more Americans infected, which translates to tens of thousands more Americans hospitalized, and unfortunately, tens of thousands that could potentially die as well. So fortunately, we do have good news on the horizon with a vaccine. Unfortunately, to get there, we might have to sustain millions of Americans who are inflicted by this virus unless we can take some very practical, severe steps today. Wearing a mask, changing our travel plans, not allowing outside people into our homes if that had been part of your previous plans, and making some tough decisions about what to do during this holiday season.